You are listening to the Horse Radio Network, part of the Equine Network family.
Welcome to this episode of the Disease Du Jour podcast on the topic of performance horse nutrition with Dr. Steve Duren. I'm your host, Kim Brown, editor of Equi Management. The Disease Du Jour podcast is brought to you in 2023 by Merck Animal Health. Steve Duren, BSMS, PhD, PAS, founded Performance Horse Nutrition in 2002. He consults with feed manufacturers and horse owners throughout the world. Dr. Duren authored the book, The 101 Most Frequently Asked Horse Nutrition Questions. And he also co-authored the book, The Concise Guide to Nutrition in the Horse. Thank you, Dr. Duren, for joining us today on the Disease Du Jour podcast to talk about performance horse nutrition.
Thank you for having me.
Well, I'm really excited because I love talking about nutrition and I love learning about nutrition. And one of the things that I want to start with is in discussions you and I have had before, you've said that performance horses are not normal, and I'm using air quotes on normal. So what do you mean by that, Dr. Duren?
Well, if you think about what a horse would do in its normal environment or natural environment, it's certainly, when we start making them into performance horses, it's abnormal to keep them in a stall. It's abnormal to feed them in meals rather than continuous access to feed. It's certainly abnormal to put them into trailers and transport them to events. And then most fundamentally, it's foreign to a horse to even be ridden. So all the things we ask of a performance horse is not normally what they would choose.
Well, and I like that. And that's one of the reasons I wanted to let us start with that today. So I realize we only have a set amount of time. And like I said, I could talk about this for an hour. I could ask questions for hours and listen to you talk. But I'd like to briefly discuss you kind of have categories that you put performance horses in that veterinarians will have as patients. So what are those categories and what do they mean?
Yeah, so the normal equine practitioner will have a variety of equine clients, and I classify these first as those clients that own horses that only infrequently ride the horse. They've worked their entire life to own the horse, but now the paying of the bills and work and family, they don't get as much time to ride as they want. So these horses are only infrequently ridden, mostly at a walk or a trot. They certainly are well taken care of. They're stalled, they're blanketed, they're all that, and become very easy keepers. So that is probably the first category. Then as horse people get a little bit more involved in the riding, I call it frequent exercise. These horses are ridden 4 to 5 days a week, usually only for a very short time. By the time they get there and tack up and visit and do all the things that horse people do, they only get ridden about 30 to 40 minutes, maybe a day. Walk, trot, mostly, probably 90% of the exercise, and just a little bit of cantering. These are the types of clients that you will have that will actually show, but they won't be full-time professional showmen. They'll show mostly in weekend shows or once a month, something like that.
Okay.
Then as we move forward, we have those that I would classify as the moderate exercise people. These horses are 5 days a week, and 15% of their riding is at performance level. So these are your dressage horses, your jumping horses, Western performance horses that are actually working at least 15% of their riding time in that discipline they're trained in. These horses exercise for a greater amount of time during the day, about 60 minutes. And because of that, their energy requirement is higher, and typically they are on more feed to accomplish that caloric or satisfy that caloric requirement. Then finally, we have those that are the heavy exercise. Again, that's the 5 to 6 days a week. Now we're doing 30% of their exercise at training speed or training intensity. About 60 minutes of riding a day. These would be like your eventing horses that are really working hard for a living. The other thing that I point out to equine practitioners, and they certainly know this, most people will overestimate how much work their horse is doing. Okay, well, yeah, he's ridden hard, and horses are capable of a tremendous amount of work. So in general, we have a tendency to overestimate how much work they're actually doing.
Today's Disease Du Jour podcast is brought to you by Merck Animal Health, the maker of prestige vaccines, Banamine, Panacur, Regimate, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their unconditional investment in our industry, profession, and community through programs such as the Respiratory Biosurveillance Program, the partnership with Equitrace, which delivers secure, streamlined record keeping and instantaneous temperature measurements when coupled with Merck Animal Health Biotherm microchips. Visit MerckAnimalHealthUSA.com for more information. Well, and that leads us into, this is what the gist of what I wanted to talk to you about. And I'm going to tell our listeners that I have seen Dr. Duren make presentations, and he was allowed me to see one of his, and I could have sat there and gone through the whole thing, but we only have a limited amount of time. So we've picked a few common diet and health conditions that veterinarians might face in the field. So I think one of the most common is poor performance or ain't doing right. So how do you address this from a nutrition standpoint, Dr. Duren?
Yeah, typically when we have a horse that's not performing, the practitioner will go through the disease scenarios that could be happening with the horse. But from a nutrition standpoint, what I'm typically looking at is, do we have a match between calorie expenditure and calorie intake? Are we feeding the correct feed? Are we feeding the correct amount of feed? Is the horse properly conditioned to do what you're asking him for? So those are what we typically look for first in poor performance. Does our feed match what we're trying to do? And is our conditioning appropriate for the event that we're trying to do? And then typically this will lead into the discovery of some disease or health condition that's often stopping these horses from being performance animals.
Okay, and then probably, and this may tie with the first, is the horse that's got diarrhea or intermittent mild colic or a little weight loss that is a performance horse in one of these categories.
And that is actually probably the area of research currently that's getting the most attention. What is happening in that digestive system to make that horse have a loose stool, to colic, to have weight issues. And what we're learning is we've studied the equine microbiome for a long time. Those are the bacteria in the hindgut that primarily ferment fiber for digestive purposes. That's what we thought they did for a long time. Now we're understanding that imbalances of those or shifts of those from one species to another affect how horses digest, affect how horses will have diarrhea, can have digestive upset or colic. So we're learning that microbiome is very sensitive, and changes in diet, changes in exercise, changes in how we manage those horses can affect that microbiome and actually send that horse into a situation where he may have a digestive system that leaks or causes chronic inflammation, and that can absolutely undermine performance. And some of the first things we see is changes in manure quality or consistency as our first tip off that, hey, we may have something amiss in the digestive system.
And moving a little farther up in the digestive system, of course, we have known about gastric ulcers for a long time, know how to find them, know how to treat them, but there's still a problem. So as far as nutrition goes, what can you suggest for veterinarians to help some of these horses who may have gastric ulcers or may be prone to them?
Yeah, so the frequency of gastric ulcers in performance horses are quite high, 40 to 93, depending on the type of horse and which study you're looking at. So extremely common. I think what the take-home message for me is horses have had gastric ulcers long before we ever started looking for gastric ulcers. So they're common, and they don't mean that they stop performance in all particular horses. So some of the risk factors with it: high grain diets, low forage diets. So as we move a performance horse from standing in a field to becoming an event horse, the amount of forage they eat declines and the amount of grain increases. So we need to take these into consideration of how we feed, and are there things that we can do to make them healthy? Well, we certainly can't change risk factors like exercise. They've got to do that. They've got to be transported. They're typically kept in stalls from a convenience standpoint. Those things oftentimes we can't change. But what we can change is the diet. We can eliminate high grain diets. We can use different ingredients to satisfy those energy requirements. We can eliminate fasting. Okay, we can eliminate some of those times when those horses don't have access to feed. Then there's some specifics of preloading that digestive system prior to exercise with specific forages. Forages we know will buffer stomach acid. So a meal of alfalfa 60 minutes prior to exercise will actually create a mat in that digestive system, specifically the stomach. And the calcium associated with that alfalfa is known to be a very good stomach buffer. So little things that we can do to help minimize the occurrence of gastric ulcers in horses.
Some really good tips there. And I mean, equine metabolic issues, we could talk, again for days about the different ones, but let's look at some of the ones that maybe veterinarians face the most.
Yeah, so we could certainly, as you mentioned, we could talk about insulin resistance and Cushing's disease, and some of those is what we normally think of as metabolic issues. But I guess what I would see from a equine practice standpoint, what they're more likely to see with performance horses is issues like tying up. We know that their horses frequently tie up. There's chronic cases of tying up, and we've classified those into three categories: what they call RER, recurrent exertional rhabdomyolysis. Most happens in thoroughbreds and standardbred, typically racehorse types. But then two diseases associated with the carbohydrate content of the diet: the polysaccharide storage myopathy type 1 and polysaccharide storage type 2. Those are very different situations. The type 1, where they actually have a known gene mutation for glycogen synthetase, causes a massive increase in the amount of glycogen, both normal and abnormal, that's stored in a muscle. So these horses, because they have that enzyme that's mutated that will just store everything, all these sugars away in the muscle, those horses benefit very much from a low starch and sugar diet. So that's typically the feeding strategy we use on those, where we minimize the use of grain, molasses, those types of things, increase the energy from fiber, both good quality hay as well as super fibers like beet pulp and soy hulls, increase the additional calorie intake with added fat. Okay, so that has been talked about for a long time. The type 2 polysaccharide storage myopathy, they haven't found that gene mutation. So it's a different situation. This also occurs in more of the quarter horse, warm blood type. And this one is characterized by these horses just don't want to work. They're just intolerant to work. They don't want to go forward. But it's not a sugar-related disease. So feeding these horses is not a simple minimizing the sugar intake of the diet. They have some issues with some protein and some contractile proteins. So the diet is very different. So we're not just starving those for sugar and starch. We're putting moderate levels of sugar and starch and changing things like the protein content and those factors in the diet.
Yeah, and as someone who had a mare with PSSM type 1, they can be managed. So it's just a matter of recognizing what it is and getting your owners to do the right things with the diet.
Yeah, and absolutely. The diagnostic is very important, because in my work, I get a lot of people that that will tell me their horse has this. And my first question back is, has it been diagnosed with that? Because unfortunately, Dr. Google is gaining in popularity, and they say, well, it's got the signs, it must have this. But without a firm veterinary diagnosis, it's hard to actually move the needle forward and manage the horse correctly if we don't know what disease he actually has.
Right, and I can attest that the testing was easy for me and for my veterinarian. So yeah, if there's the suggestion, and I would talk my owners into getting the test, because that sure changed the way, and she lived a long time with no issues related to that. But okay, and I know that we're running a little short on time, but I have to bring this one up: skin allergies. There's so many horses that have allergies, and everybody says, "Oh, it must be something the horse ate," which it could be. But what's your take on that, Dr. Duren?
Well, allergies, as you know, are caused by anything that can come into the digestive system, anything that can touch their skin, or anything they inhale. So it's a little more complicated than they ate something that
Yes.
caused an allergic reaction. The other thing that is very fascinating is we're now thinking that a lot of these allergies, a horse has eaten oats for 10 years and then all of a sudden is allergic to them. What we're thinking is happening is we're now thinking that the digestive system is actually becoming leaky, and it's causing some inflammatory response in that digestive system that's showing as an allergic reaction. So we don't think it's necessarily a food allergy. We think it's a digestive issue, that we have a digestive tract that's compromised. And now the research is rapidly moving towards, how can we heal that digestive system? How can we stop that chronic inflammatory state?
And the reason I brought that up is because I would love to invite you back to talk about leaky gut syndrome, because I think that is so important, and they're learning so much about it. And I knew we wouldn't have time to really get into it today. So love to have you back in the future, maybe Dr. Duren, to talk about that.
Yeah, I'd love to be back. It's an exciting area, and you know, we fed horses for so long. You know, the 50-pound bag of feed you get at the feed store and baled hay. But if you look at what's changed in equine nutrition, it's rapidly moving forward of what we understand. So it may be the same 50-pound bag of feed, but now we're capable of putting many more things in it that are actually not only nutritious, but healing, as far as keeping that digestive system functioning properly.
Well, and I look forward to talking to you about that and some other topics in the future. But for now, thank you very much, Dr. Duren, for joining me today on this episode of Disease Du Jour. And thanks to our listeners for joining us. And a special thanks to our 2023 sponsor, Merck Animal Health. We invite you to listen to all the past episodes of Disease Du Jour on your favorite podcast network. And if you have any suggestions or questions, send an email to me at kbrown, that's the letter K Brown, at equinenetwork.com. Disease Du Jour is a part of the Horse Radio Network, the leading podcast network for horse lovers worldwide, and a division of the Equine Network.